Good afternoon and welcome. I'm Dr Veronique van der Linde. iNova Pharmaceuticals understands that mums are often the ones managing not just their own health, but the health of the entire household. From allergies to winter colds, it can feel like something is always going around. Today we're joined by Dr Marlin McKay, who is a medical doctor and owner of Goldman Medical Center, with over 30 years of experience in private family practice. Dr McKay is a well-known multimedia personality, and today he will help us understand how immunity works, how to recognize common upper respiratory symptoms, and how to choose the right kind of clinical support at the right time. Doctor, thank you for being here.
Thank you very much. So as you're saying, these are exactly the kinds of things that most families experience that can put mums through lots of stress with regard to the children. So it's important, it's a very important discussion that we need to have, how we can face these things when our kids get sick, but I think also on an everyday level throughout the year.
Absolutely. We hear a lot about boosting immunity. What does immunity actually mean in practical terms?
So we all have an immune system, as it were. And your immune system is basically your body's army, your defense force. So when we talk immunity, it's the body's ability to recognize and respond to anything, whether it's bugs, viruses, allergens, irritants. And this immunity is really influenced by a number of factors such as your nutritional status, the amount of stress that you could be experiencing, the amount of sleep that you're getting, and then of course the big thing, viruses and irritants and allergens, things that we could possibly be allergic to. So all these things impact one's immune system and whether you're going to get sick or not.
So supporting our immune system isn't just something we should be thinking about when we're sick. It should be something that should be ongoing.
Yes, absolutely. It's an ongoing thing every day. So not just when we're sick, and it's obviously going to impact our quality of life and the type of life that we have in bringing up our children.
Let's talk about flus and colds. Why can they affect every member of the family?
So if you think about it, there are probably over 200 viruses that are around that our kids can get, or that anybody can get. And when our kids are in the home, they're kind of sheltered. But the moment they get out and get exposed to other environments, and especially in schools where there are so many other kids that are coming in with these viruses, they are very susceptible. So they've been kind of protected at home, and now we have these viruses. And no one has antibodies against all the viruses. And so we are all vulnerable to colds and flus. And when you think about a cold, is typically a viral infection. That's kind of mild, so they get the cough, the runny nose, and the sore throat. And yet the flus are more serious. Sudden onset, quick, you get very sick. You feel like a bus hit you, you just want to sleep, body aches and pains, high temperature, and also the cough, and of course the sore throat. So it can affect anybody. It's more susceptible, obviously, in the children because they're young and they have new immune systems. And so this is how so many of them can get sick like this.
So especially with the little ones, this is where really moms come into play. They don't often have time to take kids to doctors and to get further treatment. So that's why it's quite important to build up immunity and treat the symptoms of cold and flu from early on.
Absolutely. Symptom management, because again, these are viruses. So antibiotics are not going to be of much assistance in a viral infection. And so it really comes down to symptom management, supporting the immune system and managing the symptoms.
What kind of clinical support is helpful during colds and flus?
So as you're saying, symptoms are very important. What do the symptoms have? The cough, the runny nose, sore throat. So we need medication that can alleviate those symptoms because you want the child to feel better. And so if you can give something that can stop some of those symptoms, better. And then in the background, of course, talking about immunity, you want to make sure that the immune system is fully supported so that they can have the strength to fight those different infections.
So what are some of the things that can assist in that immune function strengthening in the little ones?
So as we said, nutrition is important, sleep is important, but you want medication that can alleviate the cough, the sore throat. You want medication that can alleviate the runny nose and the nasal congestion. And then, of course, you need something that can boost. So whether it's got vitamins and minerals and things that can just help the child to cope through that particular illness is very important.
So it's pre-supportive, during supportive, and post-supportive.
Absolutely.
To building immune system. Another thing that moms often struggle with is allergies in children. How do they fight this immunity every day, and how do they provide daily comfort for little ones?
Okay. So this is such an important point because sometimes it's very difficult for us to distinguish between an allergy and a viral infection. As we said, viral infections, coughing, sore throat, whereas with allergies, what happens here is that your body doesn't have the ability to respond. So what happens is you have simple pollens, irritants, cats, dogs, whatever the case is, but your body mounts a hyperimmune response to that. And so it overreacts to a simple thing, resulting in things like sneezing, itch. Itch is very classical of allergies. So sneezing, itch, and then of course if you don't, and runny nose, if you don't recognize it early enough, it becomes nasal congestion, post-nasal drip, sore throat, and even a cough. So if you can pick up the subtle differences, you treat it appropriately, and you can help to manage whether it's a cold or an allergy. But allergies are very important. They're usually seasonal, and you can see that subtle difference, the itchy eyes, the itchy nose, and then the kids just look sick, and yet it's just an allergic reaction.
Sore throats and coughs are something we see often, and they're often associated with colds, flus, and allergies. Why are they so common?
Yeah, so we know that the throat is a very sensitive tissue. We talk about the pharynx. There's viral infections, dry air from mouth breathing, postnasal drip, coughing. All these can cause irritation, can cause inflammation, and of course can cause pain. So the common complaint, my throat is sore. And so you need what we call targeted treatment for those symptoms. You want to relieve the pain and the irritation. You want to reduce inflammation. So you need something that has an anti-inflammatory effect, swelling in the tissue. Also want something that can clear out any bugs there. So it must have antiseptic support as well. And then ultimately, you want your patient to be able to swallow better and feel more comfortable. And that's what we really want to do with the supportive treatment for sore throats.
And what about for coughing?
Yeah, so cough is also very much an irritation. And it's an important way of the body clearing those irritants, especially whether it be it a postnasal drip. So it's important that one can distinguish the underlying cause, be it viral, be it irritation, be it mucus, whatever the case is, inflammation. And so the key to reducing the coughing episodes is to identify the cause.
When would you say that mums need to seek medical advice?
This is so important. I mean, we all start with usually first-line treatments just to manage it at home, but it's important to keep certain tips in the back of our minds. For instance, if the symptoms are lasting longer than a week to 10 days, and most of the package inserts, they'll usually say, do not use for longer than a certain amount of time. So that's important. If there's any change in the symptoms, so more difficulty in breathing, more difficulty in swallowing, a persistent fever, pyrexia illness is very important. And then of course in the very young and the very old, one has to be very, very careful of just treating ad lib, with the normal over-the-counter treatments, and one may need some more professional assistance. So watch, see if there's any worsening, symptoms that are persisting, symptoms that are changing. You may need extra help there.
Dr. McKay, thank you. Today's conversation really shows that managing immunity and common respiratory conditions starts with understanding symptoms and choosing the right clinical support at the right time. In our next episode, we'll move into a topic many adults think about: weight management. And as always, we'll approach it with clarity, balance, and support at the center.